Emerging issues in healthcare ethics. Introduction. As we reach the close of our journey through healthcare ethics, one thing becomes clear. Ethics is not frozen in time. The principles we've studied, autonomy, beneficence, non-maleficence, justice, veracity, fidelity, confidentiality, are constants, but the situations in which we apply them keep evolving. New technologies, shifting cultural values, and global challenges present us with questions our predecessors never had to answer. Our role is to carry forward timeless principles into landscapes that are constantly shifting. Let's explore some of the most pressing and rapidly emerging issues in healthcare ethics, areas where innovation meets moral responsibility and where the decisions we make today will shape the future of healthcare. 1. Artificial intelligence in healthcare. One of the most prominent developments is the growing role of artificial intelligence, or AI, in clinical practice. AI now helps interpret scans, predict disease outbreaks, and support diagnosis. In some cases, it outperforms humans in speed and accuracy. While this promises better care, it also raises difficult questions. If an AI system makes a harmful error, who bears responsibility? Is it the programmer, the institution, or the physician who relied on it? If the algorithms are trained on biased data, will they reproduce or even amplify those biases? Justice demands we prevent new inequalities. Non-maleficence requires we guard against unintended harm. Veracity calls for transparency about how AI reaches its conclusions. Yet many AI tools operate in black box systems that even developers struggle to explain. If AI is to serve patients well, it must do so with fairness, safety, and honesty at its core. 2. Genetics, genomics, and gene editing. In another rapidly advancing field, genetics is redefining how we understand health and identity. Genetic testing can now identify risks for hundreds of conditions, sometimes before symptoms appear, sometimes even before birth. This knowledge can guide prevention, but it can also create anxiety and difficult choices. Then there is CRISPR, a gene editing tool that allows scientists to alter DNA with unprecedented precision. It could one day remove the gene for cystic fibrosis or sickle cell disease. Yet it also has the potential to alter traits that are not illnesses, such as height or intelligence. Here the line between therapy and enhancement blurs. Justice raises questions about access. Will such interventions be available only to the wealthy? And what about the ethical implications for future generations? Since changes made to embryos can be inherited, genetics invites us to think not just about the patient in front of us, but about generations to come. 3. Telemedicine and digital healthcare is also being reshaped by the way we meet with and care for patients. Telemedicine, once a convenience, has become a core component of care delivery. It has expanded access for those in rural or underserved areas, yet it brings its own ethical challenges. Can confidentiality be maintained when visits take place over unsecured networks? Is the quality of care equivalent when physical examinations are limited? And are we unintentionally leaving behind those who lack reliable internet or the technology to participate? Autonomy supports offering patients more choices. Beneficence pushes us to use technology to improve care. Justice warns us not to create a system where some receive in-person attention while others get only a lower quality virtual alternative simply because of geography or economics. 4. Global health equity and pandemics. Ethical questions are no longer contained within local or national borders. The COVID-19 pandemic revealed how interconnected and unequal our healthcare systems are. When vaccines became available, wealthier countries secured doses quickly while poorer nations waited, sometimes for years. Justice, in a global sense, forces us to ask whether it is moral for one country to hold excess supply while another faces deadly outbreaks. Beneficence calls for sharing resources to save lives, not just within our own borders, but wherever they are needed most. Global health ethics also intersects with climate-related health challenges, migration driven by conflict or environmental disaster, and the spread of emerging diseases. In these cases, caring for individuals also means working to change the systems that create vulnerability. 5. End-of-life technologies and decisions. Medical technology has also transformed the end of life. Ventilators, artificial hearts, and advanced ICU interventions can sustain bodily functions far beyond what was once possible. But the question arises, should we always use them? In some cases, technology prolongs dying rather than living. Ethical debates now include aid in dying laws, determining when to withdraw life-sustaining treatment, and evaluating experimental life extension approaches. Autonomy affirms the right of patients to decide their course. Non-maleficence reminds us to avoid needless suffering. Beneficence urges us to focus on the quality, not just the length, of life. 6. Environmental sustainability in healthcare. Healthcare is dedicated to preserving life, yet it has an environmental footprint that contributes to global health threats. Energy-intensive facilities, disposable plastics, and pharmaceutical waste all impact the planet. Climate change is more than an environmental concern, it is a public health emergency. Those least responsible for it often suffer its worst effects. Justice demands that healthcare systems reduce waste, conserve energy, and adopt sustainable practices. In this way, ethical healthcare extends beyond the walls of clinics and hospitals to include the health of the planet itself. 7. Data privacy and cybersecurity. Finally, as healthcare becomes more digital, the protection of patient information is both a moral and practical imperative. Electronic health records, wearable devices, genetic databases, these hold deeply personal data that could cause harm if misused. Who owns this data? Should companies profit from de-identified health information? What safeguards are enough to protect against breaches? Here, veracity demands transparency about how information is used, and fidelity requires that we guard it as carefully as we guard the patient's physical well-being, bringing the issues together. While AI, genetics, telemedicine, global health, end-of-life care, environmental sustainability, and data privacy may seem like separate concerns, they share a common thread. They are all new arenas for applying the same ethical principles we've explored throughout this course. The principles haven't changed. The challenges have. And the way we balance these principles in emerging contexts will determine the trustworthiness and moral integrity of healthcare in the years ahead. Closing reflection. The future of healthcare ethics will be defined less by what technology can do and more by whether what it can do aligns with what it should do. It will be defined by our willingness to slow down in the face of rapid change and ask, is this fair? Is this compassionate? Is this truthful? Does this honor human dignity? If the 20th century was about expanding the power of medicine, the 21st century will be about directing that power wisely. That is the challenge and the responsibility of everyone who works in healthcare.